An MRI stands for magnetic resonance imaging, so it's using magnets and not like an X-ray uses radiation. And ultrasound, we also use ultrasound a lot of times. That uses sound waves. It slices through the knee electronically, kind of like a cold cut slicer. So you get a bunch of different images. You could look at the body part in a three-dimensional manner. It's good for looking at the soft tissues, cartilage, tendons, ligaments. It will also look at muscles. It can look for fluid. But what people sometimes don't realize is, yes, X-rays are probably really best for looking at like kind of like the structure of the bone. The MRI is kind of underrated as to what it can see inside the bone, but it can detect fractures, but it can also detect microfractures before they've gotten to the point where you can see them on a regular X-ray. And so the MRI, if you use the special sequences that are specifically to look at the bone, we call them stir images. Those will show those microfractures or stress microfractures or soft spots way better than any other of the other type of imaging. And so what we specifically are looking for that, we have our own MRI scanner and we have certain software and programs that we test to look for all those other things I talked about, but also specifically to look to see if there's a bone problem. Because if there is a bone problem, there are ways we can help repair it or reinforce it.